The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Welcome to the next episode of TMD Demystified. I am Tony Urbanek. Today's title is Why is it important to know about TMD? Why should everyone know about TMD, which is temporomandibular joint disorder? It is a singular disorder, is not multiple disorders. That's the first thing we need to just briefly cover. I won't go into great detail, but temporomandibular joint disorder is a series of symptoms that are created directly caused by chronic inflammation within the temporomandibular joint. Those symptoms, the most recognized symptoms of TMD, temporomandibular joint disorder, are frequent and/or recurring headache, earache, jaw pain, neck pain, ringing in the ears, tinnitus, subjective hearing loss, vertigo, dizziness, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Other symptoms can be included, confused with TMD, like dental pain, frequently confused with TMD, temporomandibular joint disorder. But it is not multiple disorders like some would like to make it. And I have certainly the information that can prove that, but there are many providers out there who want to make it complicated and want to have multiple doctors of various kinds trying to treat TMD, primarily because they don't understand it in the first place. But if you can decrease the inflammation within the temporomandibular joint by unloading the joint with a very simple device that unloads the temporomandibular joint according to a protocol, 24/7 for 2 months, nighttime only the rest of your life, then you can decrease the inflammation adequately to make all those symptoms previously mentioned go away. But back to the topic at hand. Why is it important to know TMD? Well, there are many reasons I could bring out, but the two primary reasons I want to talk about today is the prevalence of the two most common symptoms of TMD. The two most common symptoms of temporomandibular joint disorder are frequent and recurring headaches and frequent or recurring neck pain. Headache is the most common symptom associated with temporomandibular joint disorder, and neck pain is the second most common symptom associated with temporomandibular joint disorder. Now, the reason that everyone needs to know about TMD, which is better known in the vernacular as TMJ, there's so much confusion about this problem, they even named it wrong. Temporomandibular TMJ is the name of the joint, temporomandibular joint. Everybody has two temporomandibular joints. Everybody has two TMJs. Not everybody has a TMJ disorder, temporomandibular joint disorder. But the disorder, chronic inflammation within the temporomandibular joint, is constantly confused with other diagnoses, primarily by the medical doctors, nurse practitioners, physicians' assistants, who don't even have TMD on their differential diagnosis. Now, for those who are not enlightened on what a differential diagnosis is, a doctor, physician, or a dentist, or any other kind of health care provider, when he is trying to solve a problem, a healthcare provider, he collects symptoms. Symptoms are nothing more than red flags indicating that there is something wrong. But you collect as many symptoms as you can, and then you do your examination of the patient, whichever kind of examination may be appropriate, and then get lab data or radiographs, X-ray data, and lab data, if necessary, blood data, other kinds of lab data, and then you create a list of possible diagnoses that would fit those symptoms and the lab data or the X-ray data that you're looking at. And then you collate all of the data that you have collected, and you start eliminating all of the options you have on that differential diagnosis, and hopefully end up with just one final diagnosis from the list of differential diagnosis, which is your final diagnosis. But physicians, especially physicians, don't even have TMD on their list of differential diagnosis. I have investigated this thoroughly, both academically in the literature and person to person with my physician colleagues, and investigated it with my investigations with thousands of patients who have TMD and have been misdiagnosed with migraine headaches, cluster headaches, tension headaches, Meniere's disease with ringing in the ears, subjective hearing loss, that fullness in your ears like you can't hear in your ear, or dizziness, vertigo, that's Meniere's disease. And when a physician, an ENT doctor, a PCP, the physician's assistant in the convenient care clinic, run across a patient whose chief complaint is headache or neck pain, it isn't even the last thing they think about, TMD. It is not on their differential diagnosis. It doesn't come to mind. And whatever else comes to mind on the differential diagnosis, it's going to be wrong when the headache or neck pain is caused by chronic inflammation within the temporomandibular joint. So it is extremely important that everyone, physicians, physician's assistants, healthcare providers, and the dentists themselves, and of course the patients, are aware that TMD causes headache and earache. Literally, the prevalence, and this has been investigated according to the literature, current literature, the prevalence of headache in the United States and worldwide is roughly 50% of the population on a yearly basis, meaning that at least 50% of the population is bothered by headaches on a yearly basis. And it is almost as much on neck pain. Roughly 40% of the population has problems with neck pain on a yearly basis. At some time during the year, or maybe all year. That is a lot of headaches and a lot of ear pain. Now, I am not saying that all headaches or all neck pain is derived from chronic inflammation within the temporomandibular joint. Certainly, there are other reasons can be other reasons for headaches and neck pain. You can have cervical problems. You can have brain tumors. You can have strokes. All of those can cause headaches and problems with the cervical spine, causing neck pain. But if you don't have TMD on your differential diagnosis, you're going to misdiagnose the problem frequently, because headache and neck pain are the most common symptom by far of temporomandibular joint disorder, temporomandibular joint disease. So it is this divergence in knowledge between the dental establishment and the medical establishment that ends up running patients around in circles for months, years, and frequently decades, going from doctor to doctor, trying to find a solution to their headaches or their neck pain, that no one's going to find it if it's not on their differential diagnosis. So that needs to be, that problem, the divergence of knowledge, the divergence of understanding, needs to be corrected. Now, there's a move afoot in both the dental and medical professions, dental and medical establishments, to combine the knowledge between the two professions. There's a move afoot to integrate dentistry and medicine, basically to make dentistry an integral part of medicine, which it is, should have always been, but has been separated out. Dentistry has been separated out as a separate profession, not necessarily part of the medical profession. Medical profession has distanced itself, let's just say distanced itself from dentistry, which has not helped either profession, because the dentists don't know anything about what's going on around the oral cavity and related structures. They examine the patient through the mouth, but never look into the mouth. And if they see something there, the best they can do is say, go see your dentist. But they have no understanding of really what they're looking at. And the dentists themselves are so focused on teeth that they overlook constantly what would be considered medical issues, medical problems. And I think we're coming to the point, there's a recent understanding that these two professions need to be integrated with the information to the benefit of the patient. And temporomandibular joint disorder is a extremely good example of how and why this information needs to be integrated between dentistry and medicine, because of what I just discussed, the constant misdiagnosis of TMD by the medical doctors, calling it something else, primarily migraine headaches or neck pain, being directed to the orthopedic surgeons or the neurosurgeons for a workup, very expensive workup, where it could easily have been diagnosed by the PCP or the physician's assistant in the convenient care clinic. Easily diagnosed by doing a simple physical examination, a very simple physical examination. I'm going to show it to you right now. If you have chronic inflammation in any joint, your hip, your knee, your elbow, if you push on the joint, it will hurt. If you have a painful knee, the first thing that the orthopedic surgeon is going to do is walk across the room and squeeze your knee to find out whether there's chronic inflammation. If it hurts, what he knows, and the reason he did that was to determine whether there's chronic inflammation within the temporomandibular joint, within the knee, excuse me. He squeezes the knee to make sure that there is inflammation within the knee. Now, this same phenomenon happens within the temporomandibular joint, and you can make your diagnosis by pushing on the jaw joint, but it's a very simple exam. You just don't push on the joint. First, you open widely, open all the way, which pulls the condyle out of the fossa of the ball and socket, moves the condyle, the ball, out of the socket, which allows the depression right in front of the ear. And then, whether it be the doctor doing the exam or a self-exam by the patient, quickly bite together on your back teeth, fast. And if the joint is inflamed, it will create pain. If you're the doctor, the patient's going to go, ouch, it hurts under my fingertips. And if you are the patient themselves and it creates pain, you know the joint has chronic inflammation, is inflamed. And if you have a series of the symptoms that are associated with TMD, any of the above, frequent and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, a feeling of fullness in the ears, which is subjective hearing loss, vertigo, dizziness, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, or various kinds of jaw locking. If you have any number of those symptoms and chronic inflammation in the joint, which is elicited by doing that little maneuver, you have made the diagnosis. You don't need x-rays, you don't need a stethoscope, you don't need an MRI, you don't need fancy machinery, you don't do what the TMD gurus do and hook you up to all kinds of machines and spend an inordinate 2 to 3 hours of doing a workup to determine whether or not you have temporomandibular joint disorder. I mean, you either have it or you don't. And that is why it is important to know about TMD, because the misdiagnosis is so prevalent. And the misdiagnosis is so prevalent is because headache and neck pain are the two most common symptoms associated with TMD, which are also involved with 40 to 50% of the patients in the United States of America, and likely worldwide, because it's certainly not just the United States problem. So if you have an interest in helping others or helping yourself and figuring out whether or not your misdiagnosed headaches that you've been treated for months, years, and sometimes decades with medications that are not effective, with treatments that are not effective, then it is important that you not only know about the symptoms of temporomandibular joint disorder, but how to diagnose it by doing a simple maneuver that indicates whether or not there's chronic inflammation within the temporomandibular joint. If you have chronic inflammation and you have symptoms, it is highly likely that you have TMD. With that announcement, I hope that helps. I hope that clarifies. I hope it makes it simple to understand this disease, this issue that has been misunderstood for decades and called TMJ, the name of the joint. I mean, have you ever heard of somebody going into an orthopedic surgeon and announcing he has knees? No, but you hear all the time, patients go in to a doctor and says, I think I have TMJ. I hope that helps. If anyone would like to comment, I am certainly available to discuss. I can be reached at tony@tmjservices.net. If there are any providers out there, any dental providers who would like to be part of the network of doctors who use the proper device and protocol, which is a patented licensed device and protocol that can be used on a routine basis with patients with a high success rate in the 95% plus success rate, as long as patients follow the protocol of use of the device, or we call it a tool. It's a tool to use. You use the tool, you'll get the response. That information can be obtained at www.urbanektmj.com. Any criticisms? I'm well prepared to take criticisms. Make sure you bring your scientific material and proof with you when you'd like to criticize. With that said, I look forward to the next time I do a presentation, an episode on TMD Demystified. I am Tony Urbanek.